I'm actually really excited that you're going to be able to talk about this then too. So.
Yeah, and I think a couple notes to highlight off that. Just, people, I've been doing this 15 years now, and people, they look at their feet like they have pain or they have discomfort and they let it go. If you can't see, you go to the doctor and you get glasses and you spend $500 because you need to read and drive a car and be able to see, So when you can't hear, you go to the hearing doctor and you get hearing aids because you want to hear, and people spend thousands of dollars on their ears. But I feel that, it's almost like out of sight, out of mind. The pain will go away, or, I'm going to give it some time. And so they wind up having more of a physical injury or more of a problem down the road. These patients that we see on a daily basis, or the daily consumer that, they adapt to pain. They can't walk the dog. They can't go to the gym. And so they just let it go. And then it exacerbates into something or unfolds into something completely where they can't walk at all. So part of my job now in my company is just education. It's educating the public. It's educating the physician. It's educating the community on what we do. Because you will not find another shoe store or another company that's quite unique like ours, especially in this area. So
Yeah. That's what actually I was going to even start with too, because you're a board certified Pedorthist and owner of Fit My Feet stores in many locations around the South Dakota area then too. Because how many stores you have you have Sioux Falls, Dakota Dunes, Brookings, and a couple several other ones I know too then.
Yeah, we started this company in 2012 and practicing in the hospital setting, clinical setting for 5 years. I noticed that people that wore the wrong footwear and what I did as far as orthotic and prosthetics, there wasn't a marriage between the right footwear and the right diagnosis. And people were coming in and spending $150, $180 on running shoes or walking shoes, and they weren't getting the results that they wanted. Or they still had shin splints, or they still had knee pain. And so I started to educate myself from 2008 to 2010 on the fact that there is some science behind shoes. And when you put a person with a specific foot problem in the right shoe, they're going to get better. And so I really started to dive into that in 2011 and 2012. And then we pulled the trigger on opening this company, and we started our first location here in Sioux Falls. And now we have 5 locations. We're going to continue to grow. And it's simply because people realize that in today's age anyway, the baby boomers and all the people that are even retiring that want to play golf, go on vacations, do all this walking, they realize that they don't want pain. And so and they realize that the problems don't simply go away, even if they've tried physical therapy or they've done injections or things like that. So, we're just as important in the medical circle of care, and people are realizing that how important that is. I mean, your feet are important. So.
Right. Yeah, that's what I was hoping you would be able to kind of touch on too here a little bit is, like what is the impact like our footwear even has on our health, and like how is that important for people to kind of realize then too?
Yeah, and that's a good question. And so we start at the foundation, and the foundation is we need to support our feet, and our feet are our livelihood. People come in all the time and they say, well, I can't walk the dog because I'm in pain. I can't stand on an assembly line in a warehouse for work all day long, 12-hour shifts because of pain. And the pain may not be necessarily in the foot. It may be the ankle is unstable. It may be knee pain. It may be hip pain. It may be back related issues. So I educate the consumer, and I educate on the fact that kinetically everything is attached. And so when people come in here, they think, oh, well, we're just putting them in a pair of shoes and maybe a pair of orthotics, and they walk out the door and they don't realize the science behind what we're doing and how important kinesiology is in biomechanics. So, I kind of joke about this, but I don't see a lot of foot problems in today's world. I see so many doctors referring us chiropractors for back issues, orthopedic surgeons for knee and hip issues. And so there's a lot of things that we can do to fix a knee problem, and it's all mechanical. A lot of it's mechanical. There, you don't just wake up one morning and have bone on bone on your knee and have to have a knee replacement. It could be stemming from your flat feet. It could be stemming from your daily activity that's causing this pain. It may be stemming from your job. So there's a lot of variables that get thrown into the medical equation of why do I have pain? And so, again, going back to talking about, we come full circle with this. Some people go to the doctor and they get a diagnosis, and then they go to physical therapy, and that one thing may not solve the problem because they're in the wrong shoe or they're in the wrong orthotic. Some people even come in here and they get into shoes and insoles, and that's the right thing, but it may not solve the problem because they haven't had physical therapy or they haven't seen a chiropractor for an adjustment. So what we need to keep in mind is that in the medical community and being healthy, there may be more than one step to that equation to fix a problem. So some of the other questions too, how often, we talked about this when you sent me this, how often do we replace our shoes? That gets asked all the time. We get that 10 times a day. So, today's world, shoes are made, pretty decent. I mean, when somebody buys a pair of $150 shoes, it's made with more technology than somebody buying a $30 pair of shoes. So the likelihood of that shoe lasting a longer period of time is highly going to happen. So my rule of thumb, and you're going to read this all across the internet because people like to WebMD themselves or Google, you're going to find that the shoes typically in a runner or somebody that's walking periodically 3-4 times a day, you're going to replace those shoes about every 10 months is what my rule of thumb is. Now you're going to get something out of the norm where you're going to have a marathon runner training that is running, that is probably going to replace their shoes every 5 to 6 months and go through 2 pairs of good running shoes a year. And you also are going to have the patient or the consumer that has a major foot problem, that they walk with a nostalgic gait, or they have an instability issue that they're going to wear the shoe off much more than somebody that doesn't. So, but in the norm, replace your shoes. My rule of thumb is about every 10 months, every 10 to 12 months, replace a pair of shoes. Now, we get people that come in on a daily basis that see our practitioners that say, hey, I wore these shoes for 2 years or 3 years. And I cringe when I hear that because they're also the people that have problems.
Yeah, exactly. Yeah. Yeah. So that's a good rule of thumb actually too, because that's something for me, I really enjoy running. I don't replace them nearly as much as I maybe should in that way too, because for me, I guess it's hard to even kind of understand too. I'm like, they look fine and everything like that too, but even like, what are some of the common things you should be looking for when it's time to replace those? Is it something like, tread pattern wear or different things?
Yep.
Okay.
Yeah. So to hit on that just real briefly, I always encourage my runners or my people that are going to the gym, walking the dogs on a daily basis, the mall walkers, all those people that are exercising. It's 2 things. One, in 3 to 4 or 5 months, turn your shoe upside down. I tell people it's like a car tire. If you're seeing an uneven wear pattern, you should see a lateral strike on the outside of your heel. You should see your midfoot with some wear on your midfoot and then coming off your big toe. So that's a normal gait cycle, is heel strike, mid stance, and toe off should be off your big toe. And that's kind of that S curve, that back S curve, that you should see that typical wear pattern. If you see something out of the norm where your heel is completely worn off in 4 months and you're having knee pain or hip pain, or the forefoot is completely gone, when you go get new tires and the old penny trick that they put the penny in the tire to see if it's worn out.
Yeah.
If you're wearing your shoe down and it looks not of the norm, then you probably are doing something wrong, or 90% of the time those patients or those people are in the wrong shoe.
Right.
So that's number one. Number two is pain. I tell patients all the time, or customers, if you're walking in a shoe and you have pain, more than likely it's the problem. The shoe is the problem. So or it's an orthotic, or it's an instability issue. And people will go out. It mind boggles me how many people go out and they buy $100 and some pair of shoes, and then they go home and they wear them and they still have pain, and then they go buy another $150 pair of shoes and they go home and they still have pain, and then they go buy another $150 pair of shoes, and they think it's, I tell people you can buy $300, four, five, $600 pairs of shoes, but if it's not the right shoe, it's not going to solve the problem.
Yeah.
So, and people, when I was in clinic full time before Fit My Feet, I saw thousands of patients, and I would tell them, especially women, bring in what you've tried. And sometimes I ate my words, because they would bring in Walmart sacks of stuff. They'd try insoles and shoes and all these things. And before you know it, they have thousands of dollars, ate up in stuff that doesn't work. So, get an expert involved, get somebody like me, or our staff that knows what they're doing when it comes to fitting, because, when's the last time people had their foot measured? We use Bronick devices. There's a reason why we measure people's feet. There's a reason why we look at people's arches. There's a reason why we ask a lot of questions when it comes to the anatomy and physiology of your body, because we want to solve your problem. We want to make sure you're walking pain-free. We want to make sure that you don't have issues long-term. And there's people that come in that don't have any pain at all. They just say, my dad had flat feet growing up. He wound up having issues with knee replacements, hip problems. My mom had bunions. My grandma had hammer toes. We hear all that stuff, and it is hereditary. And so, you may not be in pain, but prevention is huge. I mean, people look at the future and they go, well, man, I don't want to have those issues down the road. Maybe I should do something about it. Maybe I should get into the right footwear or the right orthotic to prevent problems from happening.
Right. And that's even something like my wife we personally experienced too. Is my wife, she was having issues where she had actually a fracture on her toe, and she does a lot of running, and she came into your store. I think it was in the Sioux Falls location, and that was the first time she ever had her foot measured and had the insert done. And come to find out, she has a really high arch in her foot, but she's always been buying running shoes with kind of more of a flat insert and everything too. So once she did get measured, it really kind of occurred to her is like, hey, I have just this really high arch where I need to get into this insert. And almost immediately after that, it helped the problem so much more, because she was able to, have no pain, or like after her fracture healed up, everything like that too. She's been able to run with no issues or anything like that too. So I can really even personally attest of saying, hey, it really helps to actually get it measured and for people to look into it a little bit more, because you really kind of don't know about some of those things until you actually experience and go into it then.
Yeah. And people, it's get an expert involved. I've always encouraged, I'm not an electrician. I hire an electrician to do my electrical work. Right. So I don't change oils in cars either. I go to the mechanic. So, it's to take care of our bodies. We need to be a well-oiled machine, and to get an expert involved in a problem, you're going to get a lot farther. You just are. Going into a JCPenney's or a place and trying on a pair of shoes yourself in a self-service thing and not knowing what you're buying and having a problem, you're not fixing anything. And it could exacerbate a problem too, getting in the wrong shoe. Like you just mentioned, a lot of runners, they go and get on Google and they go to Runner's World and it says, oh, you need to be in a stability shoe. But what they don't take into consideration is static versus dynamic. I'm walking versus running. I may have a flat, or I may have a high arch, but my ankle may be hypermobile. And so, you may need a little bit of stability shoe or a motion control type shoe to solve that problem, even though that's not going to tell you on the internet. So, and get somebody that has a background in anatomy, physiology, or mechanics in some way, shape, or form. And if you're watching this video and you're not in our area, go to a running specialty shop that knows the technology of the shoes and has a well-diverse background in tech stuff when it comes to helping patients or helping the consumer. They don't need to know everything about anatomy, physiology, but when you have a science and an understanding on how your product works, it makes the job much easier of putting people in the right thing.
Right. And that's even the last question I did have for you too is, I guess, like, what are some tips or recommendations you can provide for some people too, if they're when they're picking out footwear for specific activities, like for instance if you have a runner or somebody who's walking, what should they be looking for when they're trying to pick out a certain shoe? Then is it like soles, stability, kind of give some tips and recommendations
Yep.
then?
Yeah, just in a nutshell, the three basics of shoe mechanics is you have neutral cushion, which is your high arch patients, neutral cushion. Then you have motion control, which we're trying to control some stability or inefficiency with someone's gait. Uh, and that may be a little bit of knee pain. It may be ankle instability. It may be a foot problem with, a mechanical thing. So the last one is stability shoes. Stability shoes are for your flat foot patients. So you get into a stability shoe like a Brooks Beast or a women's Ariel Brooks or a New Balance. These companies make all these different shoes for a reason. So, you go into a shoe store and you look at a wall of shoes, and you've done this, everybody's done it in their life. You look at 100 shoes on a wall and you go, oh, most people go, oh, those are cool. I like the color.
Yeah.
Or those are a cool style, especially kids and teenagers. And they don't realize that there's so much technology to these shoes, and that's why they make all these different shoes. And so, the different types of shoes, the motion control, the stability, and the neutral cushion, that's the foundation of footwear. And getting into those properly with your arch type, with maybe a foot problem, is very crucial.
Yeah.
So, and you can ask, when you go into a shoe store, we're medical driven. I mean, 60% of our business comes from doctor referrals. So, in the contracts that we have in place with clinics. But if you walk into a shoe store, make sure the guy or gal knows what they're talking about and that they have a diverse background in technology, because you want to be in the right thing.
Right.
So.
Right, exactly. And that's, I think, a really important thing for people to understand and kind of realize too, because that is really key when people are looking for that too. Is I know, especially when I try on different like running shoes too, I always like to look at like, kind of the stability piece and like, how the arches are for it too, because I generally have like a flat foot. So I'm like, I know if I'm running long distance, this is going to, really impact my feet if it's got like the higher arches and everything. But I really like to look at even like the kind of the cushiony and the wear pattern on it too, because it's like if I generally like to run on like kind of the sidewalks, that sort of thing. So I want something that's got a little bit of good cushion, because I know it's really going to hurt my knees too if I start running on something that doesn't have much for me then.
Absolutely. And the last thing, where I'll leave this is so many people, millions of people across the U.S. have foot problems, and diagnoses like plantar fasciitis and Achilles tendonitis and metatarsal issues and diabetes and arthritis affect the feet tremendously. And so the patients will buy insoles, they'll shove them in shoes, and they don't realize that they're putting an insole in a stability shoe, but they don't have that foot combination, and it just messes them up even more. So again, the education side and the background of getting into the right product with the diagnosis is very crucial. So if you have issues, if you have problems, see an expert, get in the right footwear, get in the right orthotics, and help solve your pain and your issues.
Perfect. Yeah, that's a great thing to for people to remember with it too. And so I guess I lied. I had the last question I have is, if somebody had any questions or when they're listening to this, where can they find you guys' locations, and how can they get in contact with you for more information on this, just so they can kind of know if they want to get into the right footwear then.
Yeah, absolutely. You can get on the internet, find us at fitmyfeet.com, fitmyfeet.com, super simple. Or you can call into our corporate office at 605-274-0138 and visit with one of our practitioners. On the fitmyfeet.com, you can also, if you're not in our area, and I've had people from Nebraska, Arizona, Colorado, we have a new technology called Shoe Doc Teleservices. And they can log in, they can get a Zoom call, just like we're doing today, just like Teledoc, just like teleservices in medicine. And they can get me on, just like I'm looking at you, and tell me your problems, and we'll help solve them. And then they can order the shoes and everything, insoles offline, and we'll dial it in, and you can be sitting in your living room and have me one-on-one. So teleservices is changing the way that we do medicine. Teleservices with Shoe Doc is also going to change the way we buy footwear and we buy insoles. So some new technology coming out through the pipeline. It's on Shoe Doc on our website, fitmyfeet.com. And that's a great way to have me or one of my practitioners live. Or if you stop into one of our shoe stores, you can schedule an appointment on Shoe Doc as well. So that's a way to get a hold of us locally, nationally, across the U.S., wherever we can be anywhere. So.
And that's great too, because I know something like a lot of people too in the area, if they have concerns of like trying to go there, or maybe they can't schedule a time to get in there too. That's a great resource to have too, especially when it's such a need to get people into the right footwear and to take care of something like that is a bigger issue too. Like you even mentioned too, if you have issues with hearing or eyesight, it should be on the same level as somebody who has pain issues with their feet or their ankles then. So yeah. And Nick,
Yep.
so much for your time today too, and for sharing this great information then. And yeah, hopefully if anybody is hearing this and they have any information, just reach out to the people at Fit My Feet, and a great resource to go check out in our community then. So thank you so much for your time.
Very good.
Appreciate it.
Yep. Thanks. Yep. Thanks. Have a great day. God bless.
Bye.